And that's very important for us.
There's one other component about healthcare and preventative that is oftentimes underlooked in our community, and in particular in the community of physicians, and that is nutrition. We as physicians oftentimes do not really get into the importance of good nutrition and eating healthy and exercising, because the eating habits are oftentimes primary contributors to diabetes and hypertension and other healthcare issues that we deal with on a day-to-day basis in our offices, and we as physicians, we are given ways of dealing with the issues at hand, but we don't have oftentimes the time to spend lots of time on educating patients nutritionally, which is where a nutritionist or someone in that area would be important to refer patients to get more specific information.
That's such an important point, and I wouldn't want to reiterate that because nutrition is foundational medicine. And unfortunately, most of us as clinicians, we were not trained to be nutritionists. And for me, there's so many cultural factors that affect how people eat. We cannot ignore the fact that the patient is going to be eating X, Y, or Z that is probably not in their best interest, but we need to make the time and have the courage to have that type of discussion with our patients. Now, I work with a nutritionist in my office. I did for about 7 years. And we have now come to understand that what you put in your body, through your mouth, depends on a healthy microbiome or a healthy intestinal system to absorb the nutrients that we think we should be getting, but we may not be getting. So cultural sensitivity and cultural education when it comes to foundational aspects of dealing with a lot of the chronic diseases that we see, including cancer, but diabetes, hypertension, heart disease, dementia, kidney failure, all the things that are very much dependent on how people eat, how they manage medication, how they, what type of lifestyle they lead. So for me, nutrition has always been a very functional part of my intervention when it comes to dealing with patients.
And if I may, at this moment, I want you to know that we also have on the show Dr. Jagdeo, Dr. Kyler Wiltz, who's a young practitioner, and he is, he's young to the profession, and he's been talking. One thing you made me think about is we're talking about nutrition. We are living in a moment right now where 42 million people are about, are on the verge of losing their SNAP. And in fact, there's a huge fight, going on in Congress, not only over SNAP, but over health care policy. And I just want everybody who's listening to this show, if you care about saving lives, then you've got to care about these policy issues, right?
That's right. That's right, because the politicians are the ones who have the final word when it comes to what affects all of us. From the day we're born to the day we're put in the ground, right? All life is being determined by people who may not have our best interests at heart, who may not be knowledgeable, may give you misinformation or failure to give you any information. But I think culturally sensitive information is very important. And if we can go back to the cancer topic, there are subgroups of patients. There are certain population groups that are more liable to develop certain kinds of cancers. We know in our patients of color, we tend to see a lot of prostate cancer. Prostate cancer is a disease, if picked up early, you can still lead a very long and healthy life. But early detection, early intervention, very important. It's the goal of what cancer care should be like. Getting patients in early, making the right diagnosis, and aligning them with the right treatment modalities.
And it seems to me, and
it's a simple. Go ahead. No, you please go ahead.
No, please, Dr. Dotson, please, you go, please.
I was just going to say it's a simple blood test called PSA, prostate-specific antigen, that every African American male over 45 should ask their doctor to order to make sure their PSA levels are not elevated, because if they are, it can be the earliest signs of a prostate cancer or some kind of prostate issue. So to all of our men and women who have men in their lives, 40, 45 and older African American, make sure every year you get your PSA test done, blood test, to make sure it's not elevated.
Right.
And
I think, and I think this is where education is so important. If the patients don't know that they need to request this, some doctors are not going to give it to them. This leads to a very, very fractured healthcare system where one group of patients are getting certain types of care or certain levels of care, and another group is left by the wayside. So we have to educate ourselves, and we have to stay cognizant as to what is necessary, what is good medicine, what is good health care, what should I be asking for. And unfortunately, we still have groups of patients and groups of practitioners that are not doing the right thing for our patients. So we have to educate ourselves, and we've got to reach out and also take responsibility for your health, because your health is your domain. And as much as we want to say, the politicians they're making a lot of decisions that are not in our best interest, but we also must reach out and self-educate. We must reach out and care about our communities. And talking about the prostate issue, I worked for about 8 years in Tobago, which is my home country of Trinidad and Tobago. I taught villages, the males in the villages, I taught them about the prostate. We had models, we had labs, we had screening tests that we offered. And I think when I left after 8 years, I think entire communities of men, 40 and above, knew about the prostate, the PSA, and what they needed to ask for, and symptoms they needed to look for. So I think education is very important, because ultimately, we are the ones who care for our patients, and if we don't care enough to give them the best, we have lots of issues that come up. Some of it they surface too late, but it's important for us to keep doing that.
Yeah.
Dr. Jagdeo, Dr. Dotson, Dr. Wiltz, an hour is never enough time for us to talk about these topics, and there's so much just great informative information that you're bringing to our audience. And one of the things, Dr. Jagdeo, and I'm certain if you caught that Dr. Dotson had mentioned early on, was the importance of being your own health advocate, that you know your body. You know when you don't feel something that's right. You know that you've got to get assistance, and you need to get help, and you need to push forward. And one of the things that that I thought that you laid out so greatly is what I call avoidance, particularly in the African American community, particularly among Black men. We like to not go for just give me a moment. I think I'll be all right. I want to avoid it. I don't want to acknowledge that something's going on. And oftentimes, as you indicated, that leads to the point of it being too late to receive care that could have helped you along the way. But as we wind down on our last couple of moments here, if you could just take a couple of seconds just to give some parting words to our audience as to how they can reach you and a message you want to send to them with regards to their health care during this National Pancreatic Cancer Awareness Month.
I'm an internist here based in Washington, D.C., but I call myself a global citizen. I'm a global citizen of the world. I will go wherever people need me. I actually am getting ready. I will be going to Jamaica to help with trying to bring some semblance of health care to people who are, was sorely affected by the hurricane.
Wonderful.
But yes, but I am here in Washington, D.C. I'm very reachable. I do a lot of community outreach events. Prior to COVID, I did a major community outreach event at least twice a year, and I'm willing to talk to any community group that would like to have my presence.
Wonderful.
Fantastic. Thank you so much. And Dr. Carla Wiltz, Dr. Carla Wiltz, if you could tell us how people could reach you.
Yes, sir, absolutely. Before that, I always kind of am in awe of, when I get to listen to, senior physicians and really kind of learn from them about their journeys and the amazing work that they do. So thank you both for being on here and allowing me to kind of listen to all the things that you guys have done and are doing. And as for me, I could be reached on Instagram at Dr. Wiltz, Dr. Dr. Wiltz, Wiltz. And, similarly, I consider myself to be at the intersection of, community work, healthcare, policy, all kind of bundled up into one. So every, couple of months, whether in the DMV or back in Louisiana, I try to do community organizing events, whether we do back-to-school drives, Christmas, giveaways, all that.
Awesome. And Dr. Dotson, you get the closing words. How do people get your book and how do they get in contact with you?
Well, thank you so much. The book, Unbroken, it can be purchased on Amazon. It's the #1 new read on Amazon for the last several weeks. It's called Unbroken, A Survivor's Guide to Beating Cancer, and with my name, Richard Dotson, Dotson. And you can follow me on Instagram at Richard.Dotson, Dotson 2301.
Thank you so much.
Thank you so much.
All of our guests. Thank you, Dr. Carol Jagdeo. Thank you so much, Dr. Richard Dotson. Thank you so much, Dr. Carla Wiltz. Folks, you know how we close this out. Healthcare is so important. Be certain to get all of your screening done. Be certain that you're persistent in keeping up with your healthcare, and watch what's happening on the federal, state, and local levels regarding your healthcare policy so that you are not left off the side of the street.
That's right.
When it comes time to vote for people that are pushing for policies that are going to be in the community's best interest. Don't stand on the sidewalk and watch things happen. Get into the street and be certain that the policy is in this community's best interest. Until next Tuesday, noon, Eastern Standard Time, peace, everyone.
Peace. Thank you so much.
Peace.
Thank you. Wonderful.
Thank you. Bye.
Thank you. Bye-bye.
Thank you all.
The views and opinions expressed in this program are those of the host and guests and do not necessarily reflect the views of Urban One Incorporated, Radio One, or any of its subsidiary companies.
The preceding program was paid for by Barbara Arnwine. You've built